available at the point of sale, actually. So which is basically, or at the point of convenience in terms of the point of service, in terms of, make it available to the customer. So the interaction with the insurer on very simple things, do not happen, and, it creates a dissonance in the system, and hence lack of confidence in the entire insurance sort of thing, because the need now is to drive penetration in the market. So while we could be very complex on things, but it's important to be simple and make sure that the insured, or the penetration is driven, and of course the people choose to stay insured. So that's the basic mindset, and putting all our services on that.
I wanted to share an interesting story with you about the extreme efficiency of the ICI system. Okay, one of my staff members, he applied for a car loan, and like within about 8 hours, he received an SMS for motor insurance. His application for the loan had not yet been approved. He hadn't bought the car, but I mean, this is the cross-selling and leveraging the enterprise's systems, and I think, that was tremendous. That's very efficient. So that was a very recent example.
That's one of the reasons I think a lot of insurance in India is actually, the best form of insurance selling is, of course, pushing insurance,
right.
Because thereby you avoid anti-selection. So a lot of the things which we think needs to be done is make the insurance selling itself seamless, and bundle it with a lot of other things. So one of the important points, of course, it has been to make sure that we do a lot of cross-selling and bundle it along with other products which the consumer may take.
A lot of, for example, the exhibitors here, they're hospital information system IT vendors, right? They don't know, but there's some of us here, we're trying to make life a lot easier for them in the coming years, And partly we're trying to do this by, working in the various forms like FICCI and CII to make the standardized prior authorization forms, standardized claim forms, which may not impact a HIMSS vendor too much, but there's some stuff like in FICCI where we're looking at standardizing billing formats, which will impact HIMSS vendors because they make the billing systems which the hospitals buy, and from the insurance side, we're putting out that when the bill comes to the insurance company, it must come in a certain format, which makes it easy for an insurance company to read it into their system and do various other things, Small example is we want the 8 summary heads, consumables, room charges distinctly out of this massive 8-page bill, So could you share on what some of these initiatives are doing, and because I think they're going to have a lot of impact. Next year we hope to be back at eHealth and highlight to the HIMSS vendors that here's all these standards and everything that now you should make your systems compatible because they'll enable your output to integrate well with the insurance companies and the TPAs and also the transaction platforms and everything. So could you talk a little bit about that?
Yeah. One of the issues surrounding the health insurance service delivery has been the delays and inefficiencies, and use of multiple forms is one of the reasons. There are 26 TPAs, and then insurance companies also having in-house teams, and then there are 3,000, 4,000 providers who are part of the network of cashless. So everyone is having a lot of pain in dealing with each other. So first point was to standardize the forms which the industry would use, at the industry level, so that the information that is required is available in one stroke. It doesn't have to be asked in piecemeal. It doesn't come in piecemeal. That was one point, that every information is available. If it's claim form or pre-authorization request, or it's now we have moved to the billing format and the discharge summary. These are the 4 vital documents to decide the claim or a cashless approval. So the point of friction and reducing the inefficiency as well as the friction between the stakeholders is the vision behind this. The second part important is, once we have standardized the form, it will be much easier to exchange them on electronic format, electronic platform. Today the forms are different, being written in different formats, so that makes it easy to make it compatible with electronic transactions and electronic transfer of data. That would also help in subsequently in integrating the systems. Today the systems, the talk between system to system is not there. We have substituted some of the papers, but we have not completely integrated the systems. That would definitely require use of standard forms which are compatible with the electronic format also. So that's the job done. That has been the work done by CII and FICCI groups, where we have standardized the claim form and the pre-authorization form and now the discharge summary format and the billing formats. So maybe it will take approximately 6 months to 8 months to roll out these initiatives. These are all under various stages. Some forms have been vetted and okayed by IRDA. Some forms have been okayed by the industry GIC Council. Once they are okayed and there is a go ahead with all the people from the industry, they would be implemented. And while making these forms, while designing these forms, we have taken care to take inputs from all stakeholders. Even the providers have been part of these committees, and they have given their inputs that what is useful from their perspective. We did not certainly want to increase the work at their end. Once we are demanding some forms from the insurance side, we should not be increasing workload at their end. That has also been taken care, has been taken on that. Yeah.
So one of our goals is, we've had this discussion with Dipanjan. As we get close to finalizing all of this, we'll be using the eHealth magazine, and we'll be writing a couple of articles that if you want to make your EMR generate the discharge summary like the way the insurance companies want it, then you should cover this, right?
Sure.
And in this format. And the goal is eventually to give, also with that EDI subgroup we have in the CII group, is to lay out the standards that this is how insurance companies will be able to pick up data. If you can generate it and pump it out like this, it'll make the transaction much faster. And like a word of caution to the IT vendors, what we're intending to do is reach out to the buyers, the CTOs of the hospitals, and educate them that you got to demand this in the softwares which you buy, because insurance companies pay 20-30% of your total revenue in some areas. So if you insist that the billing software generates the billing output in this format and the EMR generates a discharge summary in this format, you're going to be able to interact more seamlessly with the insurance companies and the TPAs, which is going to be good for you. So as an approach, that is a communication and messaging approach that we've kind of decided with eHealth to try to undertake over the next little while.
Yeah, I forgot to add that beyond the ease of transaction and compatibility with electronic exchange, the idea is to generate valuable data also. Today, one of the issues facing the insurance industry in the healthcare is health insurance is the pricing of the products, the appropriate data is not available. So that would certainly lead to having a very valuable data in a standard format which is available to the industry when they want to come out with a new product. They don't have to struggle with data. Like life insurance side already had very good data which is not available. That mortality data is available, morbidity data is not available in the exact science.
Right. Stephen, just again drawing on your experience from other markets, you heard about this desired goal that we have, that the billing systems generate output in a standardized format, the EMR application generate output in a standardized format. Then we have transaction platform providers like Ramon who will be moving this data around. We have recipients such as TPA and the insurance companies who will be availing of this data. So even in the States, I know there's like a lot of standards and everything. Nobody's quite gotten that right yet, because some of the problem in other countries is legacy systems, which we don't really have a problem with because we're building these systems. So we can do it right from the beginning, sort of, in which country do you know that they have very nice, seamless data flow, good standards, a lot of interaction between the systems? Is that too ideal a vision, or is that people have achieved?
Well, I think that's a very good question. I think I heard